Our case study is a possible Ebola outbreak, which is very interesting for us in Dallas since we had an Ebola scare here. I personally was more worried about catching the flu or a really bad cold. What did you think, Eriko?
I was like, oh my god, I'm going back to Japan. What did you think, Austin?
I really wasn't that worried about Ebola. What did you think, Faith?
I was so scared of leaving the house. Okay, let's get to our case presentation. We're, we're given a scenario of patients in Sierra Leone presenting with diarrhea and bleeding for 1 month. One condition that should ring a bell in our mind is Ebola. This is especially so because Ebola is endemic or commonly occurs in certain parts of West Africa, and this includes Sierra Leone, Liberia, and Guinea. This is according to the 2014 outbreak. This does not mean that an individual in another country cannot acquire Ebola. That is why the travel history from an endemic place should be very important. The signs and symptoms of Ebola are non-specific, making it difficult to diagnose. Patients present with fever, myalgia or weakness, severe headache, abdominal pain, vomiting, diarrhea. Later on in the disease, it progresses to bleeding or bruising. The diagnosis of Ebola is based on symptoms and signs, the travel history to endemic areas, and laboratory differential and confirmatory testing. The virus can only be detected after the onset of symptoms. When doing laboratory diagnosis, there are 3 stages in which we can test for Ebola. The first one is immediately after the symptoms begin, second one later in the disease, and lastly, when somebody is diseased. We use ELISA, PCR, virus isolation, or visualization of IgM and IgG antibodies. In summary, what that means is that you're trying to identify a specific antigen that causes Ebola. There are many cases that mimic the presentation of Ebola, and some of them include the other viral hemorrhagic fevers, that is Marburg virus, Lassa virus, Crimean Congo virus, dengue virus, yellow fever virus, and the other presentations would be from typhoid and malaria. One important thing that we should note is that malaria can coexist with Ebola. There are many other infections that might mimic the Ebola because of the non-specific symptoms, and they include measles, leptospirosis, influenza, gastroenteritis, sepsis, and among many others.
So in part 2, we are going to apply the 10-step CDC approach that could be used to investigate this outbreak. Here are 10 steps. These 10 steps are tailored to the situation and depend on the factors such as urgency to implement control measures, the availability of resource, time, and staff. In this case scenario, additional step for setting up quarantine has been added. Now I'm going to explain each step as it applies to a possible Ebola outbreak. The first step, before considering a course of action, investigator must gather all available information about the case and prepare for fieldwork. Things to consider in preparation for fieldwork include management, administration and operational issue, and science and investigative issue. For this case scenario, it is crucial to conduct training in handling bodily fluid and lab specimen of suspected case since Ebola is highly infective. The next step is to verify the diagnosis and confirm the existence of an epidemic. We must first establish baseline, then we compare the magnitude of current problem with baseline. In order to verify the diagnosis of Ebola, we examine case patient by reviewing the symptom and feature of illness and laboratory result and reviewing medical records. The next step is to set up quarantine unit and isolate suspected case. In this case scenario, the patient and health worker who show symptoms of Ebola virus will be quarantined for 21 days in quarantine tent. Step 4. This step is to conduct a working case definition and to identify cases. Case definition are a standard set of criteria used to help identify cases and rule out non-cases. Case definition should include clinical criteria and set restriction based on person, time, and place. Example of case definition for this case scenario is on the slide. There are also 3 categories of case definition: confirmed, probable, and possible case. The next step is to collect the data and develop line listing. This is an example of a line listing for this scenario. The line listing allows the investigator to note key information on every case and update it easily.
Step 6 includes descriptive epidemiology. This is where you describe the data in terms of time, place, and person. For time, you can plot the date of onset for all the cases in a graph called an epidemic curve. This example epidemic curve for our scenario shows that the number of deaths from the hemorrhagic fever peaked around the end of June and declined towards the end of July. For place, a common method used is to plot the location of cases on a spot map. This spot map from the CDC shows villages that had 1 or more cases of Ebola in northern Zaire. A similar map should be used for our case scenario to show where sick patients live in Sierra Leone, and if we see that they all live near a certain area, for example, this could be important in determining the source. For person, we need to collect detailed information about each case, including age, sex, residence, etc., to identify common risk factors. This information can then be used to develop hypotheses for how the outbreak started. For this step, hypotheses should include the source, the mode of transmission, and the possible exposure or risk factors. An example hypothesis for our case scenario is that a villager was bitten by an infected bat during hunting, after which the disease began to spread from person to person. Step 8 is to evaluate the hypothesis by conducting studies. By doing this, we can calculate measures of association which tell us about a person's risk. For example, an odds ratio will tell us the odds of getting the illness if you are exposed to a sick person versus if you are not exposed. Sometimes the study results do not answer your questions, which is where this step comes in. In these cases, you can change your research questions, change the way you are collecting your data, and/or plan additional studies. Using and evaluating control and prevention methods should be done as soon as you know the source of the outbreak. The primary goal in our case scenario is to stop the spread of the illness and to prevent further exposure in order to protect the population. This last step includes maintaining surveillance and communicating findings to the appropriate agencies. We will do this for our scenario to make sure our control efforts are working and that the public and the other health agencies know what's going on and what the status of the outbreak.
Part 3 involves providing our recommendations for prevention of further outbreaks in this community. Prevention of future Ebola outbreaks requires addressing how Ebola spreads through communities. The Ebola virus is transmitted when infected body fluids, including blood, sweat, vomit, feces, and urine, comes into contact with the mucous membranes, the eyes, nose, and mouth, or with broken skin. Contact with contaminated objects like beverage containers and medical equipment can also spread the disease. Case finding and contact tracing are one of the most important aspects of managing an outbreak. Case finding involves finding suspected cases of Ebola through passive or active surveillance. Possible cases can then be confirmed through laboratory analysis. Also important is contact tracing, asking Ebola cases about all of the people they have come into contact with while they were ill. Contacts are monitored for 21 days, which is the mean incubation time for Ebola, and their temperature is taken daily. If a contact develops a fever, this could mean that they are a possible Ebola case, and they must be isolated in a quarantine tent and further monitored. No fever after 21 days means that a person is likely safe from Ebola. Improving the processes of case finding and contact tracing leads to finding Ebola cases faster and IDing possible cases before they become contagious, thus slowing the spread of the outbreak. Traditional burial practices involve ritual washing and handling of the dead body, and both of these acts can spread Ebola. Mourners can very easily come into contact with infectious body fluids while engaging in these practices. Safe burial practices involve teams wearing personal protective equipment who clean the body with a bleach solution and then safely intern it in a coffin or a body bag. These teams minimize or eliminate direct contact with the dead body, thus reducing the possibility of dead body to person transmission of Ebola. If a civilian has a person who might have Ebola and must care for it at home, there are a few tips. The first tip is to don't do that. It's best not to care for Ebola patients at home. Instead, dial the Ebola hotline, and public health workers should arrive to transport the patient to an Ebola clinic. If treatment must be provided, then the following steps should be taken. Only one person should provide care for the patient. Dial the Ebola hotline. The sooner the patient is removed to an Ebola treatment unit, the better for everyone. Cover all exposed skin and wear disposable gloves. Try to remain at least 1 meter from the patient. Encourage the patient to drink oral rehydration solution if available, or water if not. Keeping a patient with Ebola hydrated is the best way to ensure that that person survives his or her disease. And lastly, don't touch the drinking vessel used by the patient. Oral rehydration solution can be prepared in a separate container and then poured into the drinking vessel. Otherwise, the drinking vessel can contain highly contagious saliva that could spread the disease. Bushmeat is the meat of wild animals hunted for sustenance. These include primates and fruit bats, the second of which is thought to be the natural reservoir for the Ebola virus. Humans can be infected through direct contact with the body fluid of these bushmeat animals. The index case of the current outbreak in West Africa was traced back to a 2-year-old boy in Guinea who was playing in a tree trunk that was also used by fruit bats as a den. The community should be discouraged from handling or consuming bushmeat since it presents a pathway for Ebola outbreaks to begin. Educating the community about Ebola and government interventions against the outbreak is highly important. Education can encourage communities to buy into the public health battle against Ebola. Community outreach can focus on the areas of what healthcare workers are doing against Ebola and why isolation of Ebola patients is important, what to do if a friend or family member is sick with Ebola, why are safe burial practices necessary, and why handling and eating bushmeat can be dangerous. An important aspect of education would be to recruit community and religious leaders as well as local celebrities to help spread your message.
That concludes our presentation. Thank you for watching.